What if I told you we could eliminate one of the oldest diseases known to humankind? A disease that still kills a person every 9 minutes. We can prevent rabies by vaccinating dogs, by washing dog bite wounds thoroughly with soap and water, and by immediately seeking medical care after a dog bite. No child should die of rabies or be orphaned by the disease. No family should suffer from rabies. To end human deaths from rabies, our time to act is now.
Hello, I am Dr. Ashani Palkumbura, lecturer in Veterinary Pathology from Faculty of Veterinary Medicine and Animal Science, University of Peradeniya. The objective of this video is to provide an overview to rabies viral disease in animals. So to begin with, what is rabies? Rabies is an invariably fatal but preventable zoonotic viral disease in mammals, which means it is usually spread to human, dogs, cats, livestock, and other wild animals such as raccoons when they are bitten by or scratched or licked by rabies positive patient. In Sri Lanka, rabies disease is mainly found in dogs. However, we can find rabies disease in cats and other wild animals as well. Usually, this disease do not transmit from man to man under natural conditions. Usually, rabies virus infect central nervous system. That means mainly the brain and the spinal cord. Therefore, when an animal gets infected with rabies virus, the animal will produce clinical signs of usually neurological signs which related to the rabies disease. Usually, this disease or this virus can be transmitted into a susceptible animal or human when there is an introduction of infected saliva through a cut or open wound, maybe mucous membranes in eyes, nose, or mouth. So, what is the incubation period of rabies viral disease in animals? Actually, incubation period is the period between exposure to the virus and to the development of clinical signs. However, in rabies, the incubation period for most of animals are not defined. But in dogs and cats is usually less than 6 months. Commonly, it lasts between 2 weeks to 3 months. In humans, incubation period is 5 days to several years. Then I'm going to talk about the infectious period of rabies viral disease. So, infectious period is the time during infected animal can transmit the disease to another susceptible host. In rabies virus, usually infected animals can shed the rabies virus 10 days prior to the onset of the clinical signs. Okay, so how can we recognize rabies positive or rabid animal? In the case of cats and dogs, they usually developed clinical signs that manifest some kind of a neurological problems, such as lethargy, fever, or food, or water deprivation, difficulty in salivating, vomiting, diarrhea, and excessive salivation. However, There are two clinical forms in rabies in dogs and cats. First one is the furious form and the second one is dull form. In furious form, clinical signs exhibits as behavioral changes, including increased aggressiveness, increased barking, fearfulness, restlessness, aimless wandering, biting, convulsion, and finally death. But in dull form, usually it is manifested as a paralytic form. The paralysis could be partial or maybe it's complete. Regardless of the form, animal can die within few days, maybe 3 days after developing clinical signs. In the case of clinical signs of herbivores such as cattle, you will see water deprivation, poor food, frequent urination, vocalization, the frequent pressing of head against walls, strain into urination, and unexplained hind limb paralysis, lameness, partial or complete paralysis, finally coma and death. The common clinical signs in bats, usually bats, when rabies bats may exhibit clinical signs such as foot, active during daytime, aggressiveness, abnormal eye movements, spontaneous vocalization, coma, and finally death. However, all rabies positive animals, irrespective of the animal species, die usually within 3 days after onset of the clinical signs. So, what are the preventive methods that we can use to prevent rabies in our pets? The first one is regular annual vaccination of your pet, maybe your cat or dog. You have to take your pet to a veterinarian and keep your vaccination up to date. And control unnecessary movements of your pet and by keeping them indoors. You can sterilize or neuter pets to reduce unwanted number of pets. Sometimes you may have to take necessary actions to remove stray dogs from your neighborhood in a humane manner. Okay. When a human is bitten by a dog or a cat or any other rabies suspected patient, the viral exposure can be rolled out in 2 ways. First one is, if the animal is healthy, then you have to confine the animal and observe animal for 10 days whether this animal is developing clinical signs that's similar to rabies disease or whether this animal died within 10 days. If the animal is healthy after the monitoring period, then we can come into a conclusion this person is not exposed to the rabies viral infection from that particular animal. But if the animal died during the monitoring period, the animal testing in the lab is the only indication to confirm the infection. In that case, you have to submit a fresh brain or head sample to a laboratory as soon as possible. If there is a delay in submission of a head or a brain into the laboratory, then you have to maintain refrigerated conditions until the transportation. And during the transportation also, you have to keep the sample on ice. As a conclusion, rabies is a viral disease that can be fatal but preventive disease with proper vaccination and prophylactic measures. This disease mainly found in dogs in Sri Lanka, but cats and other wild animals also can transmit disease in between mammals. Therefore, proper and responsible pet ownership and reduction of stray dogs will help in controlling and preventing rabies disease in animals in Sri Lanka. Thank you.
ජලබීතික රෝගය එන්නතක් මගින් වළක්වාගත හැකි ඒ වගේම වෛරසයක් මගින් හරගන්න රෝගයකි. වළක්වාගත හැකි නමුත් රෝගය වැළඳුනහොත් 100%ක්ම මාරාන්තික වන රෝගයකි. පිස්සුබල් රෝගයේ 99%ක්ම නිවෙස්ස ඇති කරන සුනකයින්ගේ හපාකෑම් මගින් හටගන්නා අතර රෝගයේ පවතින වෙනත් සුනකයෙක් නිරෝගී සුනකයෙකු සපාකෑම මගින් නිරෝගී සුනකයාට රෝගය හටගනී. එම සුනකයා ඔබේ නිවසේ සුරතලයට ඇති කරන සතා විය හැකි. ඒ වගේම අනෙකුත් ක්ෂීරපායි සතුන්ගෙන් වුවද මෙම රෝගය ව්‍යාප්ත විය හැකි වේ. උදාහරණ වශයෙන් මීයන්, රිලවුන්, ලේනුන් වැනි සතුන්. මෙම සතුන් මිනිසුන්ගේ ශරීරයේ හපාකෑම් මගින් හෝ සීරීම් සිදුකිරීම මගින් මිනිසුන්ට බෝවිය හැකි වේ. ඒ වගේ මෙම රෝගය ලෝකයේ රටවල් 150ක පමණ ව්‍යාප්ත වී ඇති රෝගයකි. ජලබීතික රෝගයේ මිය ජනගහනයේ 95ක් පමණ ආසියාවේ සහ අප්‍රිකාවේ ජීවත් වන්නන් අතරින් සිදු වනවා. ඒ වගේම 80ක් පමණ ඒ රටවල ග්‍රාමීය ප්‍රදේශවලින් වාර්තා වනවා. රෝගයේ කෙතරම් භයානක නම් එයින් වැළකීමටත් ක්‍රම සහ විධි තිබිය යුතුයි. එකක් තමයි සුනකයන් එන්නත් කරණය කිරීම. මේ තමයි ඉතාමත් පහසුම හා ලාභදායී ක්‍රමය. තවත් ක්‍රමයක් තමයි සුනකයින්ගේ සපාකෑමෙන් වළකීම. මේ සඳහා බල්ලන් සමග ආශ්‍රය කිරීම සිදු කරන්නේ කෙසේදැයි කුඩා දරුවන් දැනුවත් කළ යුතු වෙනවා. ඊළඟ වැඩිහිටියනුත් දැනුවත් කළ යුතු වෙනවා. ඊළඟ ක්‍රමය තමයි සපාකෑමකට ලක් වූහොත් සිදු කළ යුතු ක්‍රියාමාර්ග. ඒ කියන්නේ ප්‍රථමාධාර කටයුතු කිරීම. සපාකෑ ස්ථානය හෝ තුවාලය හොඳින් සබන් යොදා විනාඩි 15ක් පමණ සේදීම. මේ සපාකෑ විගසම සිදු කරන්න ඕනේ. මේ සඳහා විස බීජ නාශක දීර්ඝයක් වුණත් පාවිච්චි කරන්න පුළුවන්. මේ මගින් රේබීස් වෛරසය විනාශ කරන්න පුළුවන් වෙනවා. සපාකෑමෙන් ඇති වූ තුවාලයේ ස්වභාවය හා ස්ථානය මත සහ සපාකෑ සුනකයාට රේබීස් ඇතිවීමේ හැකියාව අනුව. ඒ කියන්නේ ගොඩක් වෙලාට ස්ට්‍රේ ඩොග් කෙනෙක්, ඒ කියන්නේ දඩාවත යන බල්ලෙක් නම් අනිවාර්යෙන් මේ ක්‍රියාව මේ ආකාරයට රෝගයෙන් වැළකීමේ ක්‍රම අනුගමනය කරන්න ඕනේ. සුනක ඇල්ලීම හා ආහාර දීමේදී සත්වයාගේ කෙළ ශරීරයේ ගෑවීම සිදුවොත් ඒ අවස්ථාවේ හොඳින් සබන් යොදා සේදීම ප්‍රමාණවත් වෙනවා. ඒ වගේම රුධිරය වහනය නොවන සුළු සීරීමක් හෝ කුඩා සපාකෑමක් සිදු වුණා නම් මේ අවස්ථාවේ
Let us work together to spread facts and not fear.
Join with us for the Global Alliance for Rabies Control
and raise awareness on a global level.
It starts with you.
One small step towards prevention from rabies can make a big difference.
Don't leave the issues unheard.
Do your part and educate the world about it.
Take the right steps and precautions on time before it's too late.
Don't forget to get your pet vaccinated.
Keep your pets confined.
Protect small pets from predators.
Report stray animals to local authorities.
Don't approach wild.
Keep bats out of your house to save a life.
Did you know?
Rabies can progress to death within 1 to several weeks.
We must make everyone aware of it.
Do your responsibility today.